Hello, and welcome to Hope for Life, transforming lives on the front lines of crisis. I'm Rabbi Torbeh, and I'm the President and CEO of Project Hope. It's really wonderful to have you here with us today. Even though COVID-19 has changed all of our lives, it's amazing to see how many of you joined us virtually. And I'm really excited to share with you how Project Hope is transforming lives around the world. For more than 60 years, Project Hope has been trusted to bring hope and health to tens of millions of people in every corner of the world. I recently got back from Beirut, where I saw firsthand how important this work is, how critical it is to be there in the moments that follow a devastating crisis. Last year, Project Hope reached nearly 1 million people worldwide. Our work helped train more than 22,000 healthcare workers globally, screened 76,000 people for diseases, and reached 750,000 people living with HIV/AIDS. But most importantly, we were there in the moments when it mattered the most. In the wake of a devastating hurricane, on the borders of a humanitarian crisis, and on the front lines of the battle to eliminate HIV/AIDS. This year, because of COVID-19, everything has changed. No one could have imagined a year ago how ill-prepared we will be to respond to a pandemic. We all predicted that a pandemic was going to happen. It was a matter of when, not if. That's why I'm incredibly proud of our team's response. To date, Project Hope has distributed more than 9 million pieces of personal protective equipment to workers on the front lines of this virus. We've launched one of the most ambitious healthcare worker training programs in the world, which has trained over 68,000 doctors, nurses, and frontline personnel. We've deployed expert medical volunteers to hospitals across the US and reached over 130 countries with the tools they need to fight back against COVID-19. Yet, this work is only one part of our mission to improve the world's health. Our life-saving work has not stopped. Project Hope works in 5 main areas: disaster and health crisis, infectious diseases, non-communicable diseases, reproductive, maternal, newborn and child health, and health policy. I'm so excited to share more about our work with you today. In the next 45 minutes, you'll get to hear from Project Hope team members, a few special guests that you might recognize, and from people and organizations who, like you, are committed to saving lives. You'll hear about our work in places like the Bahamas, Sierra Leone, Colombia, and Malawi, as well as what we are doing to help in the global fight to stop COVID-19. Then, we'd like to share a special recognition of 2 of our key partners in our COVID-19 response in the United States. Finally, I'm happy to announce some really amazing ways that you can help support our mission today as you learn more about what hope looks like around the world. Hope Market is a completely unique shopping experience where you can see how the value of your purchase can help save lives around the world. You can support our mission today by clicking on the buttons you see on the screen or by using the navigation below. But for now, let's get started. First, I'd like to introduce you to Melanie Legrand, VP of Social Responsibility for Major League Baseball. Melanie?
Baseball is an important part of the cultural fabric of our country and in places like the Dominican Republic and beyond. When Hurricane Dorian hit the Bahamas and the COVID-19 crisis followed, Major League Baseball knew we had an amazing partner in Project Hope, and we had to help. We are proud to partner with Project Hope in their response efforts and understand the importance of partnerships in helping to solve the country's greatest health crisis. That's why I'm excited to introduce this next section, featuring Project Hope's Director of Emergency Response and Preparedness, Tom Cotter.
Hi everyone. What an awesome endorsement from Melanie. We are so grateful to have Major League Baseball on our team. My name is Tom Cotter. I'm Project Hope's Director of Emergency Response and Preparedness, and I'd like to tell you a little bit more about how Project Hope responds to emergencies around the world. The initial moments following a disaster are crucial. Whether it's Mozambique, the Bahamas, or Louisiana, every minute can mean life or death. Project Hope responds to some of the world's worst health emergencies with medical relief that saves lives. And this work is increasingly important. The number of weather-related natural disasters has tripled since the 1960s, putting more and more people in the path of deadly storms like Hurricane Laura, which just tore through Louisiana. Almost exactly a year ago, I was in the Bahamas responding to the aftermath of Hurricane Dorian, which ripped through Abaco Island with winds up to 200 miles per hour. Project Hope was one of the first organizations on the ground treating survivors, delivering desperately needed medical supplies, and helping communities begin to pick up the pieces. I was there literally hours after the storm hit, and I saw firsthand the level of devastation. Entire towns destroyed, clinics and hospitals were completely overwhelmed, and people had little access to even the most basic necessities. Most people living on Abaco Island were left with nothing. People like Gustavo were there too, delivering relief on behalf of Project Hope to families trying to survive in Dorian's aftermath. But we weren't just carrying boxes. We were bringing hope to people in the Bahamas who had lost almost everything. During the worst disasters, many people face a harsh realization. If they have had any chance of survival, they have to leave behind their homes and almost all of their possessions. We saw this in Louisiana just last month, where thousands of people returned after storms to towns that were devastated, homes that were ruined, and clinics that were closed. In times like this, it's hard to think of anything beyond the most immediate needs. But in a world where storms like Dorian and Laura are more and more frequent, we also have to focus on the long term. Fueled by climate change, natural disasters like this are a major contributor to a global healthcare crisis that demands action. Project Hope understands this reality. And that's why, in addition to the urgent relief and medical care we provide now, we also bring long-term solutions that transform communities and health systems. I'll never forget what I saw in the Bahamas. The level of destruction was breathtaking, and the stories I heard will always stay with me. But so will the critical work that I saw Project Hope accomplishing on the ground. Treating over 1,500 survivors, distributing over 16,000 hygiene kits, and delivering over 3 million in medicines and medical supplies. You can help Project Hope continue to respond to emergencies and build resilience in the wake of disasters like Hurricane Dorian and Hurricane Laura. Please click the donate button on your screen. Make a gift today. You'll be making a life-saving difference in communities in need.
Hello everyone, I am Per Falk, President of Ferring Pharmaceuticals. Our purpose is to build families and help people live better lives. And we have been partnering with Project Hope in their life-saving programs since 2008. In 2017, together with other partners and donors, we joined forces with Project Hope in a multi-year program aiming to save lives and provide care to newborn children in Sierra Leone. Through these efforts, thousands of children have received care, and 1,300 healthcare workers have been trained to allow them to save even more lives in the years to come. Hope is essential for everyone, all human beings, but it can mean the difference between life and death for those facing poverty and discrimination in their daily lives. The way Project Hope helps healing people and transforming lives is a true testimony to what hope looks like in practice. And that is why I and all my colleagues at Ferring are really proud and grateful to be allowed to play a small part in their efforts.
Hello everyone, my name is Tara Kangarlu, and I've spent much of my career as a journalist reporting on the many challenges that face women and children in some of the most vulnerable communities around the world. Now, in each community and country, I've witnessed how a healthy start at birth can help change a child's life, and how so many mothers and babies never get that chance. For many mothers living in rural and disenfranchised communities, this challenge is a difference between life and death. In fact, 99% of all maternal deaths take place in developing countries due to these challenges. Now, I'm talking about many places where Project Hope works and has had a tremendous impact on the lives of so many mothers and their babies. These are women who often live far from hospitals and are forced to deliver their children at home with very little medical support, just very little available to them, both during the childbirth and after their babies are born. Now, the tragic reality is that thousands of women and infants die every single day. But the good news is that Project Hope has the solutions to change all this, and hand in hand with you, help build a world where no woman nor their babies risk dying from something so preventable.
I'd like to introduce you to a woman named Musu Yambasu, who lives in one of the hardest places in the world to be a mother, Sierra Leone, a country of nearly 8 million people and less than 250 physicians. When Ebola struck in 2014, a staggering 21% of Sierra Leone's overall health workforce died, forcing millions of women like Musu to give birth at home in unsanitary conditions without any skilled help and with no support or instruction on how to care for a newborn. In short, Sierra Leone is one of the most dangerous places in the world to be a mother. But here, Project Hope and Dr. Joy Nailey, the head of pediatrics at Bow Government Hospital, are working hard to change this very harsh reality. You see, Musu has a history of giving birth to small babies, and her 7th child, a girl, was no exception. But this time, something was different. Musu's little girl was the first of her 7 children to be delivered inside a hospital. She was also the first to be treated with a method called kangaroo mother care. Kangaroo mother care involves wrapping a baby skin to skin on the mother's chest for warmth, creating a kangaroo-like pouch that simulates the womb. Here, in hospitals where incubators and baby warmers are scarce, this is a life-saving method for premature and low birth weight newborns. With many hospitals in Sierra Leone lacking the basics for baby care, Project Hope worked tirelessly inside Bow Government Hospital to build a devoted kangaroo mother care unit where vulnerable infants like Musu's daughter can be wrapped for up to 24 hours a day. Now, thanks to Project Hope, nurses like Angela have the skills they need to save more babies, and mothers like Musu can have peace of mind when bringing their children into the world.
Now this is what makes Project Hope different. They understand that you can't just bring in outsiders and then leave. You have to be there for the long run. And they understand that. They understand that they have to equip doctors and nurses with the skills they need to save lives in their own communities. Strengthening healthcare workers around the world is one of the best ways we can help save lives. And this has never been more true than now, with COVID-19 making it crystal clear on how critical our frontline doctors and nurses truly are. But there's still so much work to be done. Every day, more than 7,000 newborns around the world die in their first 28 days of life. It doesn't have to be this way. It truly does not have to be this way. And you can help. Please take a moment and donate to Project Hope by clicking on the donate button. Your gift will help keep life-saving programs like the one in Sierra Leone to keep going, so that women like Musu and their babies have a healthy chance of survival. Together, we can help build a world where no newborn risks dying from preventable causes, and where every mother has access to the care they so deserve.
Hey everyone, it's Josh Allen from the Buffalo Bills. As many of you know, charity work is really important to me, especially when it impacts health. Nonprofits like Project Hope allow places around the world to increase their health systems for people in need. I'm really excited that you are here with us tonight. Project Hope has been such a huge inspiration for me, seeing all the work that they do. The next part of our event is going to highlight another way that Project Hope is supporting people throughout the world and how your support and donations help them get their work done.
Thanks, Josh. It's great to have your support. And good luck this season. I drafted you on my fantasy football team, so I'm really going to need you to step up your game. My name is Chris Skopek, and I'm Project Hope's Executive Vice President for Global Health. Right now, there are more than 70 million people displaced around the world, a staggering number that has doubled in just the last 20 years. 37,000 people every day are newly displaced, many of them by humanitarian crises that have no end in sight. We use this term a lot, humanitarian crisis. It can take many different forms, but wherever these crises occur, one thing is always true. Beneath every humanitarian crisis, there are families making the agonizing choice whether to stay and risk violence and persecution or flee and risk the unknown. Leaving home is an act of desperation. It forces parents to struggle to provide food and shelter for their children and makes even basic health care out of reach for the sick, the elderly, and the injured. But in times of crisis, Project Hope is there, thanks to the generosity of our partners, standing side by side with frontline healthcare workers who are driven by a sense of purpose and compassion. Around the world, these brave men and women respond selflessly and heroically in the face of unimaginable challenges so that their family, their friends, their communities, and those desperately seeking refuge receive the medical care and attention they need. One of the world's biggest humanitarian crises, in fact, is right here in the Western Hemisphere. More than 4 million Venezuelans have fled their country, the vast majority of whom have traveled by foot across difficult and dangerous terrain to neighboring Colombia. This mass movement has had a major impact on Colombia's healthcare system, pushing some hospitals near the border to beyond capacity. Last year, at one hospital where Project Hope is working, 26 of the 30 women with high-risk pregnancies waiting for treatment were Venezuelan. When I visited, I witnessed the overload of patients filling the halls and waiting rooms and lined up outside in the courtyard, while overworked staff rushed to handle this unprecedented demand. This influx of Venezuelans represents a titanic shift into Colombia's health system. Since the start of the crisis, Colombia has received nearly 1.5 million Venezuelans. Just imagine the entire population of Portugal migrating to the US. They've come in search of the things they need to stay alive: medicines, medical supplies, and healthcare they can no longer find on the other side of the border. Pregnant women, fearing the poor and unsanitary conditions in hospitals in Venezuela, are arriving late term with little to no prenatal exams in order to have a safe and hygienic environment to give birth. And COVID-19 has made the problem even worse. Large crowds make social distancing impossible. Doctors and nurses don't have the protective gear they need, and there's no way to tell how the virus may be spreading when thousands of people cross the border every day. To help manage with this massive influx of patients, Project Hope is providing surge support in the hospital's OB/GYN departments, as well as essential training, equipment, and supplies for staff. That support is providing a lifeline for Venezuelans and Colombians alike, many of whom have had to go months without basic medical care, including baby Emma. At only 3 months old, baby Emma was dangerously malnourished and struggling with a congenital heart defect. Her parents, Nyla and Luis, were running out of options in Venezuela, where more than half the country's doctors have left since the start of the crisis. Nyla and Luis couldn't stop Emma from losing weight. Every doctor they consulted told them something different. She was prescribed blood pressure medicine and diuretics, and Nyla was told to feed her only 3 times a day. Emma's health began to spiral. She became dehydrated, lethargic, and her weight continued to drop. Clinic after clinic, they were turned away. Together, they made the difficult decision to travel hundreds of miles with their fragile baby to cross the border into Colombia, where Project Hope was waiting to welcome them with the critical care Emma needed. A Project Hope doctor immediately tended to Emma, improved her nutrition, and brought her to specialists who properly diagnosed and treated her, ultimately preventing another casualty of the Venezuelan crisis. Day by day, Emma came back to life. Today she's animated, growing, and also back home. With her health stabilized, Nyla and Luis returned to their life in Venezuela, 300 miles by foot and bus, to reunite with their family and return to work. Luis's family has a farm where he's helping with the harvest, and Nyla works as a labor attorney representing merchants and civil workers. A crisis can strike any time, as so many of us have seen during COVID-19. You can give hope to families in crisis by clicking the donate button and making a gift right now. When you give to Project Hope, you're doing your part to help more babies like Emma get life-saving care. Because every humanitarian crisis is a human crisis, and everyone deserves hope.
I'm Steve Ruskowski. I'm the chairman, CEO, and president of Quest Diagnostics and long-term board member of Project Hope. And at Quest Diagnostics, we're empowering better health with diagnostic insight every day. And that's why for 14 years, we've been a proud partner of Project Hope. Because what Project Hope does is what we do, but around the world. And they are on the ground providing better support and services and capabilities to healthcare delivery systems every day. So we hope you enjoy the program. We are proud to be part of this program, and the world needs Project Hope.
Hello everyone. I have to tell you how excited I am to see so many people in attendance today. My name is Renuka Gade, and I'm a proud board member of the Project Hope organization. Project Hope is an amazing organization to support, and I hope you all have been inspired today. The world is facing some pretty difficult challenges. Apart from the COVID crisis, we already have some very challenging situations. Currently, only half of all the countries, for example, have the number of health workers needed to deliver quality healthcare services, which is why Project Hope is desperately needed, especially in Africa, which has 24% of the world's disease burden and only 3% of the world's health workforce. As you've heard earlier, more than 20% of Sierra Leone's entire workforce was killed in the 2014 Ebola epidemic. So the problem on hand is pretty huge and daunting. The future of health demands action now. In just 10 years, an increase in non-communicable diseases and an aging population will generate a need for 40 million additional health workers. However, a shortfall of 18 million health workers is predicted by then, unless non-communicable diseases can be addressed. Otherwise, the world really will be facing a $30 trillion cost burden by 2030. It's just 10 years from now. Malawi is a beautiful, vibrant country, but sadly, it also has one of the highest HIV rates in the world. In a busy market in Mangochi, people are about to get HIV tested, and Project Hope is right there to set up this mobile testing unit in the marketplace because it's a good location to offer rapid HIV testing to the many traveling vendors like Peter. In less than 10 minutes, Peter can find out that he's negative for HIV. Felix, his tester, was trained by Project Hope. And as they wait for results, Felix discusses safer sex practices with Peter. Like many places, there's a lot of stigma around HIV in Malawi. But Peter, who's just 25 years old, is part of a new generation, taking an active role in the fight against HIV. Let's look at Emelita, who's leading a savings group that is transforming the lives of women in her village by helping them save money and start their own businesses. She's also HIV positive, but is passionate about preventing the spread of HIV. A few years ago, Emelita took a Project Hope training to become a community resource person in her village. Today, she makes home visits, going on her bicycle house to house to educate people in her community about safe practices, including how to prevent mother-to-child transmission. In addition to providing HIV testing and other health support, Project Hope offers solutions that lift up entire communities, mother care groups, village saving groups, business training, parenting skills, and safe spaces for young people. Importantly, we bring together people with and without HIV to break down stigmas about the illness and talk about their status. At the Rate of Hope Market, you can donate the value of items you purchase to Project Hope and help us bring life-saving services to more people like Peter. Humanitarian aid often looks like emergency relief, but real change, even in disaster and crisis, looks long-term. When you donate today, you help us provide sustainable solutions like these that change the narrative for tomorrow and forever. join us. Join the Project Hope community. Thank you.
COVID-19 is one of the gravest threats to global health in our lifetime. Around the world, as doctors and nurses fight the virus's spread, Project Hope is mounting a global response to provide life-saving support where it's needed most. So what are we doing? Delivering life-saving personal protective equipment in high-risk areas, training health workers to treat COVID-19, deploying medical volunteers to provide surge staffing in hard-hit locations, and helping health systems ensure continuity of health services. For over 60 years, Project Hope has worked the front lines of the world's greatest health challenges. That work has never been more important than now. Since the virus first emerged, Project Hope distributed over 8.6 million pieces of personal protective equipment, provided training for more than 53,100 health workers, and reached 119 countries worldwide. In the United States, delivered critical equipment to Arizona, California, Illinois, Louisiana, Maryland, Massachusetts, Michigan, New Jersey, New Mexico, New York, Pennsylvania, Puerto Rico, and Texas. Activated surge staff and mobile testing in hard-hit areas like Illinois, Maryland, and Navajo Nation. Provided free online training for doctors and nurses to become master trainers in infection prevention and control. Around the world, mobilized personal protective equipment in China, Colombia, Dominican Republic, Ecuador, Ethiopia, Indonesia, Malawi, North Macedonia, and the Philippines, given vital training and contact tracing in high-risk countries. Launched a remote COVID-19 training program for health workers in at-risk countries. Project Hope is placing power in the hands of doctors, nurses, and other health workers around the world. Completed training for about 2,000 master trainers, who have trained more than 51,000 health workers around the world. Although COVID-19 is far from over, Project Hope continues to provide equipment, personnel, and training throughout the world.
Hi, I'm Sunita Baldi, Vice President, Chief Development and Communications Officer at Project Hope. Earlier this year, Project Hope partnered with the Avril Lavigne Foundation to raise funds for our COVID-19 response. Avril recorded a new video for her song, We Are Warriors, using photos and footage from our response, along with stories from her fans around the world. We'd like to share this video with you today and say thank you to Avril and the Avril Lavigne Foundation for their collaboration and partnership.
Here's my song, We Are Warriors, dedicated to the frontline workers. The proceeds go to the Avril Lavigne Foundation and Project Hope to protect and support the frontline workers. I just want to say a huge thank you for continuing to keep us safe.
We'll pick our battles cause we know we're gonna win the war. We're not rattled cause we shattered all of this before. Steadier than steel cause we're ready with a shield and sword. Back on the saddle cause we've gathered all our strength for more. And we won't bow, we won't break. No, we're not afraid to do whatever it takes. We'll never bow, we'll never break. Cause we are warriors, we'll fight for our lives like soldiers all through the night, and we won't give up, we will survive. We are warriors, and we're stronger, that's why we're alive. We will conquer time and
From the stories you've seen today, partnerships are everything to Project Hope and a key necessity to doing our work. Every year, Project Hope recognizes the often unsung heroes of global health, both individuals and organizations whose outstanding accomplishments provide better health for the world's most vulnerable people. This year, we are awarding 2 special awardees for their partnership in our COVID-19 response in the U.S. First, the Leadership Award. It honors a distinguished leader from a company or organization which has made a significant contribution to global health through the donation of medicines, medical supplies, equipment, or expertise. Project Hope is pleased to honor Business Roundtable for their leadership and partnership in spearheading our U.S. COVID-19 response. As an association of more than 100 of America's top companies, their leadership in rallying to respond to the frontline needs of our U.S. health systems as the COVID-19 pandemic grew was unprecedented. The generous support of 15 companies allowed us to respond with more than 6.5 million pieces of personal protective equipment in 10 states nationwide. Please welcome Joshua Bolton accepting the Global Health Leadership Award.
On behalf of the 200 CEOs of the Business Roundtable, thank you for honoring our organization with Project Hope's Global Health Leadership Award. In this time of crisis, America owes its gratitude to our frontline healthcare workers who put their lives on the line every day, working countless hours under difficult circumstances to combat the virus and save lives. At the onset of the pandemic, many of these brave professionals faced dangerous shortages of critical medical supplies. Project Hope and Healthcare Ready were there to help, procuring, importing, and delivering essential equipment to medical professionals in communities across the country. In recent weeks, critical supplies have also been distributed to support disease prevention in areas hit by Hurricane Laura. Business Roundtable CEOs have been proud to support all of this work. Let me give a quick shout out to the many companies that have contributed: ADP, Alliant, BorgWarner, Chubb, Lockheed Martin, Micron, NextEra, New York Life, NRG, Pitney Bowes, Rockwell Automation, S&P Global, Synchrony, Vistra, and Worldwide Technology. Thank you to Project Hope for recognizing these companies' generosity and, more importantly, for the great work you do every day.
Next, the Partner Award acknowledges an individual who has been a lifelong champion for global health issues. Project Hope is excited to honor Nicolette Lewis-Saint and Healthcare Ready for their partnership in responding for the U.S. Business Roundtable initiative. With a focus on strengthening health systems and supply chains, Healthcare Ready, in partnership with FEMA, prepared and coordinated our U.S. COVID-19 distribution. We are pleased to recognize them for their swift approach and commitment to community resilience. Please welcome our 2020 Global Health Partner Award recipient, Nicolette Lewis-Saint.
Healthcare Ready is a nationally focused nonprofit organization that was originally founded initially as a coalition after Hurricane Katrina. We've had the joy of being able to partner with Project Hope and be a friend to this organization for many years, and we continue to commend the work that you do, not just in the United States, but really across the globe, and recognize that the role that you hold is so critical for so many individuals and so many communities who depend on your support during a crisis. During the COVID-19 pandemic, we've had the opportunity to translate our friendship into an actionable partnership with the help of the Business Roundtable. And with the support of the Business Roundtable, what we were able to do was actually take private sector resources, donations that came from companies, and turn that into procurement that Project Hope was able to manage, and then work with us to be able to manage the distribution of to communities all across the United States. It's important to remember that while we're talking about 6.5 million pieces of PPE, we're also talking about lives, missions, livelihoods, and communities that have been supported, not just by the PPE, but also by the relationships that come with those deliveries, the communication that we've been able to maintain, and the recognition that they are not going at this alone, and that they have partners like Healthcare Ready and Project Hope and the Business Roundtable who are committed to serving and supporting them as well. So with that, I am really thrilled to be able to accept this Global Health Partner Award. It is an honor honor for our organization, and all of my staff join me in thanking you for this honor and commending you on the work that you have done this year. Thank you, take care, and be well.
It's because of each of you that Project Hope is able to save and transform lives around the world. We would not be doing this work without the generous support of each of our donors. If you make a gift today through the mail or through your donor advised fund, please be sure to reference the Hope for Life event. We thank you for all that you do, and our teams and beneficiaries around the world thank you as well.
Hello, I'm Pete Mooney, and I'm honored to serve as the chair of Project Hope's Board of Directors. Thank you so much for joining us at Hope for Life this year. I hope you've been inspired and filled with hope by what you've experienced today, and I am so touched that you've been able to stay with us through the end of the program. All of this work you saw today is made possible by partners and supporters like you. You can help us heal people and transform communities by making a gift. There are several ways to make a contribution to Project Hope. First, make a quick donation by clicking on the donate button now. Second, shop in the Hope Market. You can browse items and services used in the stories you heard today, choose the ones that matter the most to you, and donate the exact amount to support our work around the world. From everyone at Project Hope, thank you once again for your support. It means the world to us. We hope you have a great rest of your day, and thank you again. Goodbye for now.